When I first experienced pain in my right knee, I thought the pain was part of aging. Hello, I'm Linda. I'm a part-time cleaner at a food court. My job requires me to be healthy and physically fit since I spend a large amount of time standing and walking around. When I'm not working, I'm babysitting my lovely grandson. One day, when I was at the park with him, the knee pain got so severe that I could not walk or get up from my seat. That episode got me thinking a lot about how my knees were affecting me. I was concerned if one day my grandson needed me urgently and I couldn't get to him in time. My knee pain got worse and worse over the years. I was in pain when climbing stairs or even when I was walking. On some days, I couldn't even go to work because the pain was unbearable. So I arranged a consultation with an orthopedic surgeon at SGH who confirmed that I had osteoarthritis. He advised me to go for the knee replacement surgery. Initially, I was very afraid to go for the operation because of my age. I didn't know what to expect. Would I be bedridden for a long time? Or how long would it take to walk again? However, I'm very grateful to my doctor because he was very reassuring. I really felt that he and his team had full confidence in the surgery, and their guidance at every step made me feel better. They also provided me with reading materials to understand the surgery better. They patiently explained to me what to expect before, during, and after the surgery. On the day of the surgery, I reported to the same-day admission center. I registered myself at the counter, and a nurse brought me to a consultation room for my checkup. I was put under anesthesia, and the surgery was completed very quickly. I recall meeting my surgeon in the operating theatre, and the next thing I knew, the surgery was done, and it was successful. They even said I was expected to start exercising in a few hours. A while after my surgery, a physiotherapist came to work with me. I started with bed exercises. When I could handle that without much pain, I progressed from a bed to a chair. Then I practiced walking with the use of a walking frame. I was quite amazed by how quickly I was walking again. I only stayed for one day and got discharged after that. Before I was discharged, my doctor and his team came to check on me. Lastly, I was also taught some basic exercises I can do at home to make a full recovery. After the surgery, my knee felt better and I could return to work. I'm grateful to my doctor for encouraging me to do the surgery and the entire team for their care and concern. With the total knee replacement surgery, I don't have to worry about pain, and I can spend quality time with my grandson.